I'm Helen Forbes. I've been teaching nursing for well over 30 years in both the academic and clinical settings. Health assessment is a particular interest of mine, as I know students require a lot of support as they master these skills.
Hello everybody. I've also been an academic for a long time, and I've been lucky enough to teach both in a classroom setting, within a skills or simulation setting, as well as in a clinical setting. So we've got quite a lot of thoughts about what needs to be taught and how, and what has worked over time and what doesn't. One of the big issues has always been, what to teach and how much, hence the title of the seminar. Now, we had our own thoughts about this and were quite frustrated by the textbooks that were available, the skills videos that were available, and in fact what we had all been involved in teaching. And we were noticing that quite a lot of the stuff we were teaching students was definitely not being utilised in the clinical areas. And so we started investigating this, and some of it was just, from tradition. It's what it had always been taught. It was certainly what was in textbooks and videos for health assessment, which were largely from North America. And the other really important part of the what, about what to teach, is whether it's a nursing focused skill, and that also is a very big question. So the students need to know enough knowledge and skills that are nursing focused, not medically focused. So if you have a look at the textbook, you will notice that we've organised the chapters around the skills that all nurses need, and those skills that specialist or advanced practice nurses need.
Our textbook is designed in such a way that it's sort of beginning practice component to each of the physical assessment chapters, and advanced practice, so that if a student, for example, or a nurse is progressing on to become expert in cardiac nursing, then those later skills can be added as they progress through their career. Anonymous attendee has identified that health assessment is a huge topic and it's hard to narrow down the core assessment skills to teach. What would you say the essential skills are? So Liz and I have grappled with this over the 3 editions of our health assessment textbook, and we're very confident that we have been able to separate out the skills so that we've got really beginning skills. So, for example, in respiratory assessment, if a student can really develop confidence about how to watch and read the patient's breathing, what's making sense, what's wrong, what's abnormal here, and linking that to the colour of their skin and their periphery, and linking it to their heart rate and so forth. So it's all about how we put it together. We don't think there's much to be gained by percussing the chest, as Liz mentioned before. And so it's just this really trying to focus on the real basic stuff, but that's the complex stuff for students. So we've picked out the ones that we think are most important and the ones that are likely to be used, and that is the cranial nerves involved in stroke, for example. So whether the person can swallow and so forth. So we don't bombard them with too much. Liz and I developed some videos with the help of one of our colleagues, Josh, and we developed 6 videos. And this came about because of our dissatisfaction, which was available, through, mostly they're American type videos. So we identified 6 areas that we thought students really struggle with based on our observations. And that was cardiac, respiratory, abdominal assessment, neuro, and vital signs from a manual and from an electronic point of view. So, for example, with neuro, we didn't go into Glasgow Coma Scale because there's an excellent video that is available anyway, that's online. So why repeat it? It's absolutely great. So we did the surveillance approach, how to assess conscious state, but, how do you assess patients' movement and so on. The cardiac is really quite simple, because we recognise that students just had trouble about where they put their stethoscope, what are they expected to hear, and so on. So we don't go into JVPs or anything like that. That's more the province of a much more experienced nurse.